back.
Hmm.
We are live.
Good evening, everyone. Myself, Dr. Ashish Kale, a chairperson of Family Welfare Committee. I must say that every podcast is unique, but this will be a much more special to all of you because I'm going to take the interview and the podcast with the two of the unique persons and having the same interest. Saying so, it is a 312 podcast, and I must say this is a brainchild of our president of Foxy, Dr. Sunita Tandulwadkar, madam, because she has given us a vision that 365 days she will be there and all of us will be going to have a different interaction with the different personality in the different fields, and madam has given us such a good platform where we can enjoy taking the interviews with the eminent people also. And madam make a point that whenever, even if she is traveling, even if she is in a meetings, she make a point that she will going to attend this particular podcast series. So here is our madam. To introduce madam, I know everyone knows her very well, but the common thing today, I just take a 1 minute that once you in a Maharashtra, everyone knows Shiva Chhatrapati, that is Shivaji Maharaj, and in an endoscopy field, we call a lady Chhatrapati because she has a different credit to her, and when she enters the OT, she make finish the surgery in no matter, and being a war, she always equipped with the everything. Now 5:30 a.m. in the Ruby Hall, she is very well equipped with the robotic surgeries, and as all of you know, she is a pioneer in a much more things in the city of Pune. So all the things are just to say a few words. When you talk about the endoscopy in the
Ashish,
Pune, madam, just a 1 minute, only 1 minute. You collect the few words and the few names and few pioneers in the field of endoscopy. The same holds true with our guest also. So I welcome Dr. Sunita madam to address this, and then I will introduce our guest, Dr. Pandit Palaskar sir.
thank you, Ashish. Thank you. Most beautiful is you have chosen Dr. Pandit. I'm so glad, and I still remember the last month when we wanted to do your lab, Dr. Pandit, and we did not got, I think, Wi-Fi internet neatly. We were in Agartala, and then. I still remember we wanted to meet together. Dr. Pandit, thank you so much for coming on a Foxy platform. It's like, endoscopy के team member के साथ आए तो घर आए जैसा लगता है. Foxy is too big to call it as a family. But IAG, ISAR, they become a smaller organization comparatively, and everyone becomes like a family. This Gyan Pravah podcast series we started in January, and it's at 8 p.m. We have 30 committee chairperson. So 30 days, 30 committee chairperson take an interview of the faculty. Believe me, Dr. Pandit, I thought these are the future leaders of Foxy. I'm giving them a platform, how to take interview, how to select your faculty. It may be from any field they choose in. We had even Nitin Gadkari, and we had actress Revati, and so many people. I can't tell you globally. So many achievers, more than my chairperson. I got evolved as a person because every day, 8 p.m., I join and I interact with the faculty. And I think it is a lot to learn. We are in a very small, tiny OBGYN platform. The world is so beautiful, and there are so many achievers in this world. One life is not enough to explore everything you realize. But that's a beautiful thing, Foxy. It's now near December, and the most important thing is I'm handing over to our dear friend, another endoscopic surgeon. So I'm glad we just follow each other in every. I think he cannot enter in ISAR, but endoscopy also, he was my secretary. So it was beautiful to work. So, Dr. Pandit, you as a leader has outperformed. You have taken IIG Bar to a very beautiful height, and you are very silent, but the amount of work you do is huge, huge. I love you all the time. With you, your leadership, with your endoscopic skill, and your humble nature. Keep this. This is your uh, gesture, which is so important in life, that you achieved everything but still remain humble. Thank you. Ashish,
Yeah.
fantastic. I will be joining the viewers link.
Yeah.
Ashish is one of my very dedicated chairperson. Any dependable. Anything you tell him, he will do. I still remember when I wanted, I have to go to Agartala, I have to go to Shillong, Meghalaya. We are doing a Sampurna project in these east states, and it was very important for me to reach to the unreached places. In Foxy, if you have taken the president post, you need to. But I was scared also. I made a phone call to Ashish 4 months ago. I told him, Ashish, these 4 days you will travel, because he did his post graduation from East India. He knows that language. He goes still there as IVF consultant in Arunachal Pradesh. So I said, I don't know. For me, Arunachal and Meghalaya and Agartala all is same. Please, 4 days, be with me, Ashish. I want to get this in my life. See, to take 4 days is very difficult, very difficult. And just you traveled with me till I come back to Pune, you were with me. So, thank you so much, Ashish. You are very dependable chairperson, and you will always be a good leader any organization you go. Thank you.
Madam,
Thank
thank
you.
you very
I
much.
see
I
you.
learn much more things from you, madam. And it's my privilege that I traveled with you because you are such a great personality in my life and great influencer in my life. Whatever I am today, it because of the few people in this era. I really respect you from the bottom of my heart, madam. Thank you for those words.
Thank you,
Thank
madam.
you.
We
So,
always
Dr.
learn.
Pandit,
Yeah.
our pattern is I join the viewers link, and from there I enjoy the discussion of both of you.
Yeah.
So see you sometimes in person, and all the best for your next week conference.
Yeah, we are missing you, madam. We learn so many things from you. We always see you as a visionary leader. Your leader qualities are, beyond imagination. You create leaders, and, under your leadership, so many leaders are growing like us. Thank you so much, madam.
Thank you. Thank you, Dr. Pandit. Once again,
Thank you.
welcome on Foxy platform.
Yeah.
Thank you.
Thank you, madam. Thank you.
Yeah, thank you. Welcome all. So today is 312 podcast series, and now it is my privilege and pride to introduce to you my guest. He is a guest to all of you, but he is really a good, you can say a friend, mentor, and much more than that. Is a person whom I always respect to. So today's topic is from innovation to integration in the journey ahead of Gynaec endoscopy. So I found this person who is really apt for this particular topic is none other than Dr. Pandit Palaskar sir. He's a director of Endo World Hospital, Aurangabad, and only the name of Dr. Pandit Palaskar will make that Aurangabad pride that he is belong to the place. When you utter the Pandit Palaskar sir and IIG, a past president of IIG, the map comes down to, and boiled down to the one single point that is Aurangabad, and he is now taking over as a president of Maharashtra chapter IIG. And I am really happy, sir, that you had taken so much of time of yours and joining this as a podcast. So, sir, welcome to this podcast. And now we'll start. This is a informal interactions to all those who don't know Dr. Pandit Palaskar. It's not the single word in this Foxy platform who doesn't know you, sir. All of them know you, a fantastic endoscopic surgeon, a person who has a five-star hospital in a city of Aurangabad, and it's my privilege that my Sasurwadi belongs to Aurangabad, and I really feel happy today to interact with you. So welcome, sir. My first question will be like, as everyone knows, I seen the when you taken over as a IIG president, you shown the first slide of yours and your wife, and there is called as a farming at the
Yeah.
background. So,
Yeah.
sir, this speaks a volume and your integrity, and that the you are always attached to your ground and the soil. Sir, I wish to understand how is your journey in the medical field and how you venture into endoscopy, sir.
Yeah. So basically, I belong from a remote village, Palsi, which is around 30 kilometers from Aurangabad, now Chhatrapati Sambhaji Nagar. So my background is farming. So from there I came to Aurangabad, then graduated, post graduated. During PG days only, I used to like the word. And I did my post graduation from. Swami Ramanand Tirth Rural Medical College. Again, it is in rural area. So during our PG days, there was nothing was there. Only cesarean section and open hysterectomies, all those routine Gynaec work and obstetric work
Yes,
was there. Then I during last year I realized there is a future for endoscopy. So I moved to Mumbai. Then I joined KM Hospital as a lecturer. Then in evening time I used to go to Dr. Trivedi's hospital for OPD. Then I used to do morning OT and then rush to medical college to 9 to 5 job. And again in the evening night I was doing the job to learn the endoscopy and IVF. There I learned endoscopy, learned the IVF, then came to the practice. And it was a journey, always attending the conferences, workshop. Then I got influenced by the IIG. Then I became member of IIG. I was highly influenced by those days of. I passed out in 2000. So that time there was no much training in India. Only three centers were there: Dr. Trivedi, Dr. Rakesh Sinha, and Prashant Mangeshikar. So I joined Dr. Trivedi's place. I got the chance to attend many conferences. He always used to organize one conference every 1 or 2 year, and that was how I came in contact with IIG. Then I was influenced by so many people in this endoscopy world. Then I met people like you, so many good friends from IIG, and then the journey started in IIG. Initially, there was not much training in India, so only the source of getting trained is live workshops. So those days, the live workshops were no houseful. When if the conference is declared in any corner of the India, we wish to go and attend the workshops day and night. That was how we learn. Then we started the practice. Fortunately, by everybody's support and God's grace, we've grown up. We had good practice, and today we're here.
sir, I just wanted to ask you one personal thing.
Yeah,
That when you I seen you like working as a IIG president, your philosophy of working is totally different because every president has his own vision, own
yeah,
implementation. But I seen you a person who has done the work from the within, and then if you work so much that the juniors like us get motivated, no, if the president is doing so much, I need to do. So
yeah,
these are the, sir, certain silent features I've seen in your working. When I realized, sir, there was a session in AAGL, and the person who has done the tuboplasty was a chairperson of your session.
yeah.
And I can recollect those moments being a pride Indian, that now I can call you a Sambhaji Maharaj of endoscopy. Why, sir? I have a reason. Because, sir, I seen when you start your instrumentations or your surgical skills, there is no called as repetitions.
Yeah,
It is such a smooth surgery. It is a treat to watch. Like when Sambhaji Chhatrapati Maharaj used to take the swords, and it is comes with the always a victory. He is a person with a victory. The same when you enter into the abdomen and just do the tuboplasty is the one of the just an example. Sir, what is the thought process of going for the surgery when you go anywhere in the world? Because I've seen you AGL, I've seen you internationally. So, what is the mindset that the youngsters can build up?
yeah. To achieve excellence, there is only way is practice. Practice, practice, practice. See, achieving the skill of the best suturing, it has not grown in years or 2 years, 3 years. It took almost 15 years. So it is not a 1 day or 1 year procedure. It is a gradual process. Still today, I am learning. You have to always keep your axe sharpen.
Yeah,
You have to
true.
watch how people do the suturing. I know, it's always imagination. When we start the
Yeah.
surgery, I think the repetition is already done in the mind. No, you visualize you are cutting here, the needle is going through the lumen, and
Hmm.
the already the imagination process has already done. So,
Started.
I think the every work is done twice, first in the mind and then in the field, right?
True.
And there is no shortcut for the no what you call as practice. You have
Hmm.
to keep on doing practice, practice, practice.
Sir, another question from my mind, because you are working in the endoscopy field now a decade, more than that. So you seen all the progress in the instrumentation or a camera. See from the optics, we go from the step by step because our topic of podcast is like innovations. So
Yes.
how you thought of the optics makes an important part of the integral system of the endoscopy, because you had worked with the 2D system, then 3D HD cameras, now a 3D camera system, and now you have a much more advanced technology like robotics. So how you are looking as a endoscopic surgeon, how the optics are evolved
Yeah, I
and
think.
what it makes a difference to the surgical skills, sir.
I think when it comes to endoscopy, the most important thing is vision. Unless you have the good vision in the pelvis or in the abdominal cavity, you can't do the surgery better. I did with a single chip camera, I think almost for 10 years. And I used to do everything. I thought, why the HD camera is required. I used to do the tuboplasty with the single chip camera also. That days, around 2010. Then we came the HD camera, three chip camera. Then the vision again improved. We improved the vision improved, the accuracy of the procedure improved, and ultimately the success rate of the reconstructive surgery also improved. Then came the 3D. I think 3D is a game changer. Initially, for 2 years, I registered 3D. I thought, our brain got adjusted to the 2D vision. We can reconstruct in brain within the 3D,
Mm,
and we can do everything with 3D. But when I took 3D, then it was totally different. We could recognize the retroperitoneal structures, the pelvic nerves. I think with 2D, it is little difficult to appreciate the retroperitoneal tissues like hypogastric nerve, the exact course of the ureter, the vascular tree. I think when it comes to complicated surgery, we have to shift to 3D. 3D nowadays, now I am using 3D since last 7 8 years. And when somebody gives me a complex case and I am operating in 2D, it is difficult. I think it
mm,
is just impossible to operate complicated cases with 2D, even though it is HD, because we are now used to do the 3D, the surgery with 3D camera. 3D really
mm,
gives good depth perception. It is good magnification is there, and there is no fatigue.
mm, mm.
Yeah,
Yeah.
definitely the camera system has really improved, and that's why now we can do all these complicated cases of endometriosis, all retroperitoneal surgeries, radicals, pelvic, paravertic lymphadenopathy. It is so much ease with the 3D.
Sir, now comes the billion-dollar question, because like our generation start with the vehicle suturing and everything, the suture materials also changes. They come
Yeah.
from the different perspectives. They come from now not less sutures. They come with the strata fix. So, do you think, sir, still we like youngsters, those who are joining this field of endoscopy, these innovations are really a boon, or it's a basic things you need to be well versed with?
Definitely, as we are advancing in science, the technology is day by day changing. Really, these what we call this as barb suture, they have really improved our suturing time. When it comes to myomectomy, barb suturing really makes the myomectomy procedure shorter, and it reduces our operating time. And ultimately, I think healing will be better with barb suture, because with simple suture, every time we have to take intermittent sutures, and it increase your time and you get fatigue. So I think for myomectomy, barbs are good. But barbs can't be used for every surgery. When it comes to hysterectomy, we can't use barb suture. For vault, you have to take the simple non-observable suture material. And if you are using barb for the wall suturing, I think it is will be the waste of the resources.
Yeah,
So
true.
we have to balance. When it comes to bladder suturing, you have to use the barb suture. When it comes to intestinal suturing, barbs will be better. So depending on the the requirement, we have to wisely use the resources. But I think the we have to be well versed with the simple sutures. I always tell suture is the future in endoscopy.
True, true, sir.
Yeah,
Absolutely true. I should quote this as a star mark of this podcast.
yeah,
Future is future.
yes.
Sir, one thing coming down to the back to your uh, personal questions. Sir, coming from the endoscopy training from the KM hospital and then from Mumbai, like and establishing into the Aurangabad
Hmm.
and getting into the such a beautiful and the five-star hospital. So how the person think of going from Mumbai into the again into the Aurangabad city and then developing into a, such a five-star hospital? What was your vision?
Yeah, coming back to from Mumbai to Aurangabad was not easy. No, it was not a easy process. Anybody gets attracted to that glamorous city. I was also got attracted, but at the back of the mind there was uh, in the mind, and my wife also supported. We should give back to our society from where we have grown. In Mumbai, there will be thousands of endoscopic surgeons, but what about the people in our region? That was discussion among with me and my wife, and then ultimately we decided it is better we go back to our village and serve the people who have always supported to us. And then there was always the team. We can create the hospitals like Mumbai or foreign countries. Though the journey is not easy,
Hmm.
it took almost 10 years to establish the practice. There was so much resistance when I came to Sambhajinagar. There was so much resistance to the endoscopy. People always used to doubt whether this person will complete the surgery, whether this is beneficial. It is little costlier.
Hmm.
I used to roam to many places. In nearby Bid, I was used to visit Saturday, Sunday, Nanded, the Ahmednagar, Nasik. Every Saturday, Sunday, I was going and I used to operate 18, 20 cases per day in those days. So mm there was a lot of struggle, hard work, and it takes time.
Sir, again coming to the your own questions, like you said, madam, I seen madam, your wife always stood by you in your installation during your prominence. Where, but she is always at the back and she is looking after everything silently. But she is a backbone support to you. So,
Yeah.
sir, ever you come to know that madam is angry because you are roaming around with the IIG and the organization. So whether she is really, how can you? Because the same thing happens with me. It's always the as how you balance the work, home, and organization, sir.
The struggle is always there.
Yes. Any key messages,
We
sir?
have to enroll. I have to always enroll all this. No, अभी this is ये अभी last post है, इसके बाद मैं नहीं करूँगा.
True. Sir,
But
again coming to
we
the
as endoscopic surgeon, we can't sit at home also. Then, then she realized,
True.
yes, if this is your passion, I can't keep you back at holding at home. You do whatever you like. I am there to handle all these. Really, without her, I can't do anything. She's
True.
managing the
Absolutely.
home. She's managing such a big
Hospital.
hospital. The relatives, she take all the brunt.
Yeah.
Yeah,
So now, like Indian hospitals, we always talk about the cost. But always we have a staff training is a major consideration.
yeah.
What practical steps can the center, like your center, is an excellent center of endoscopy and IVF also. So, what are the technologies that will increase the patient financial burdens, or it may decreases the financial burdens? Because in India, now this is the podcast for all Foxians. Always they thought about that the center of excellence बनाना है, लेकिन उसके लिए खर्चा ज्यादा लगेगा, ट्रेनिंग ऑफ द स्टाफ लगेगा. So you always has that. Now you had a world class center, and as well as the fellowship programs, as well as training schedules. How you like the person can evolve in their thought process?
I think we should not, we have to wholeheartedly put the investment in constructing the best hospital. We should always buy the best equipments. I will always prefer to buy the best equipments than buying the
Mm.
best car. I have
Yeah,
simple car,
true,
but
true.
I will always choose 3D laparoscopy, the best incubator in the IVF lab that will give the best results, best embryos. See, we work at least minimum 4 to 5 hours per day in the OT. The OT environment has to be
Yeah,
pleasant. We
true.
have all the OTs we have which have the laminar flow, all those things, which is not required for Gynaec setup. But we should
Yeah.
always have the best. We work at least 4 to 5 hours, and that work environment has to be best. So we have first we have to be comfortable. Our staff has to be comfortable. We
Mm.
need to provide them sitting room, the place for the eating, so that they are happy. And
Mm.
they will always think 10 times while leaving your organization. So our staff usually 90% of the staff is there with us since last 20 years. So nobody leaves unless there is some genuine problem or the female gets married to the person from
Yeah.
the outside city. Otherwise, our drop rate is almost zero. So we should take the every step that our staff is like our family member, and they should be comfortable. Then they will work for like anything for you.
Yeah. Now, sir, coming to the your personal question again.
Hmm.
When I enter your hospital, I seen a Sai Baba idol. I seen the ringtone of yours. If someone can call Dr. Pandit Palaskar sir, is a Sai Baba ringtone comes. Sir, what is the mythology and what is the ideology you carry out? Because our president of Foxy, Dr. Sunita Tandulwadkar, also
Hmm.
she goes to the yatra of the prominent holistic places in India. I know the spirituality plays an important role, but when I enter your hospital, that is a obviously, and I lean to that particular gesture. So how it implemented to you, sir, from your childhood?
Yeah, we are from Warkari family. Vitthal. We are all, our the whole village is our parents, the grandparents, all, we all belong to Warkari family. So since beginning, since childhood, we are spiritual people. We have a temple in our the farm also at village. Since beginning, we used to go to mandir do to the Haripat, the Naneshwari, Parayan, and we are follower of the Bhagavad Gita. In today's era also, whenever I get time, I read Bhagavad Gita, Naneshwari. Yeah. So we are spiritual, and I leave everything to the God. So whatever is there, best is there, bad is there, I leave to the God. I believe God. So there is no worry. When somebody is taking care of you, you are always free, no? Mm.
Sir, nowadays, now coming down to our topic of endoscopy,
Yeah.
because I will be tossing the ball between the two, sir,
That's
when I take your podcast.
yeah.
Because see, sir, nowadays robotics are rapidly increasing. So how you see the balance between the conventional and robotic surgery and the flexible endoscopy over the next decade? So do you think that there is will be a, again will be the role of the endoscopy like what we do at 3D will be persistent, or everyone will be now a new generation, they thought about robot is the only way out? So what is your vision or your thoughts on that?
I think the implementation of robotics is going to help only in the complex cases. Robotics is not cost effective, or it is not needed for simple procedures like diagnosticoscopy, simple hysterectomy. That is not cost effective. I think it will be cost effective for the retroperitoneal surgeries like deep endometriosis, bowel resections. the prosthetic surgery. For Gynaec, I don't think it is very much useful. The world today is too much technology driven. It is driven
Mm.
by the industry. The robotic companies, they are unnecessarily pushing their, that robotics into the general practice. I think it is not good. Definitely, it is good for the long procedures where the surgeon gets fatigue. The retroperitoneal surgery, endometriosis surgery, sometimes it takes 3 to 4 hours and we get fatigue. So in that cases, it may be useful, but for benign diseases, simple hysterectomies, it is not cost effective and it is not needed also. You and me can finish the simple hysterectomy in 30 minutes, 25 minutes with the better energy devices. We have vessel sealers. Hysterectomy can be finished in 15, 20 minutes, simple benign cases. So that talking,
Or
by,
the robot.
yeah,
Yeah.
any whatever the team is getting accustomed to the robotic surgery, it takes at least 30 minutes to do the docking.
Sir.
So we have to wisely choose between the which is good for the patient and doctor. For simple procedure, I will always choose normal routine 3D laparoscopy, and maybe for complicated cases when I will grow older, in those days I may
No.
take photo robo.
So now again, every time we talk about AI and AI integration, there
Yeah.
is a system of the navigations. You've seen that software which will tell you the hysteroscopic views and where are the myomas and how you address those myomas to explain it to the patient. Do you think the AI will be have a much more implication in a future endoscopic field, like what they are marketing now about the textures and how the virtual hysteroscopy view will be?
The again the same thing is happening with artificial intelligence. Unnecessary so much importance is given to the AI because we as scholars we are there in the ranks. We studied so much hard during 11, 12 through the NEET. We got admission to medical field. We are so much intelligent people. So why when intelligence is already built in your mind and your brain? Why we require artificial intelligence? I don't understand. People tell, the AI integration gives better ureteric, that when it will illuminate while you do the surgery.
Mm.
I don't think the ureter is there below the peritoneum. Any average surgeon can dissect and visualize the ureter. So why you require that fancy things?
True.
Yeah. That much
Sir,
intelligence, every person who is becoming doctor and postgraduate, that has that much intelligence. So why you require the additional help of artificial intelligence? Uh, I don't understand. I think the
sir,
only way to prevent the ureteric injury or vital tissue injuries, we have to be aware.
true, true.
Yeah.
So now coming down to the personal question again.
Hmm.
So I told you that I will be juggling between the two. Sir, once I come down to Aurangabad and I seen your IVF labs and the technology behind that everything is updated and such a well versed person, up to date knowledge, up to date labs, everything. So how you make your team the same thing that it's a maintaining the par excellence, whether it is Aurangabad, whether it is everywhere, because your lab, your IVF lab, your endoscopy lab is at par. How you trained the staffs? Because if this is listening by the 42,000 gynecologists across the India, they must be talking that sir is having the trained staff, but the training, it's not the trained staff. You train them, you
Yeah.
make them. So who is the person behind those training? Because sir, you must be busy in your surgeries. Your wife will be busy in IVF and endo, like ART. So who is a person that one should be knowing about?
Actually, it is a teamwork. We have three, four gynecologists along with us, and any staff we recruit, he or she is not directly taken into the OT or IVF lab. Initially, we give 6 month, 1 year training in the IPD department. So gradually they come to visit to the OT. Then next after 2 to 3 months they will wash. Then they will assist. It is a gradual process like our fellowship program. Any fellow
Mm.
directly we can't take them to assist. They have to observe. They have to wash the instrument. They have to learn the assembly of the instruments. So it is a gradual process. it may take almost 1 year for the newcomer to come directly into the OT. So, in a rural, we are in the periphery of the, we come in the tier three city, we don't get the trained staff. So, any staff who is qualified, GNM or BSc nursing, we appoint them, we give them training, and we train them. So, any crude product we can make them finish.
But sir, that's again the my again the personal question to you.
Mm.
So, sir, you make them into finish, but your temperament you never lost in a surgery also. In a workshop, I seen you operating 1,000 times. You never lost your temperament. You never lost your any calmness. What is the secret behind Dr. Pandit Palaskar sir's not to lose a temperament, not to become angry? Even if the bipolar is not working, you'll say, okay, it will work. So, how that patience you built up, sir?
Bhagavad Gita.
How really nice, sir.
So, we have to see the cause and effect of your this, temper, losing the temper. The shouting on the staff, it will first harm you, right? So this rag, rag first harms you. It has three effects. It will harm you. It will increase your adrenaline, and the whole day you'll get spoiled. The staff will get spoiled. He may lose the job. So first you have to understand that shouting on anybody first causes harm to you. So do you want to get harmed by you yourself? We have to understand this. Then only way is to remain calm, and the with time it will improve.
Wow. Sir, I think I should take those words from you because these are the things that the experience makes you and the person makes you apart from the all of us like ordinary person. Sir, coming down to the again our organization efforts, the training modules and the next generations. Now a generation Z is coming, sir. You must be
Gen
knowing my daughters and everyone is into that particular category of generation Z. So they wanted that immediate effect, sir. The immediate they wanted to become an endoscopic surgeon. Immediate they wanted to become retroperitoneal surgeon. Immediately they wanted endometriosis surgeon. They immediately they wish to go into the robotics. So how the young endoscopic surgeon master today to stay globally competitive in 2035? What is your message to them?
Immediate is not possible. There is no shortcut for success. That is, whatever you do, there is no shortcut. You have to go through the process of doing the basic gradually, and then come become the advanced endoscopic surgeons. There is no shortcut. Anybody, even me or you or anybody can't be. There is no shortcut for the the what you tell excellence. You have to do daily, gradually. Unless you build the confidence, unless you do the every step repeatedly, it is not possible.
Sir, again, like everyone wish to be now become a globally recognized surgeon.
Mhm.
Youngsters, they make a reels because,
Mhm.
sir, this is the podcast which goes to the young gynecologist to a older one, and everyone does it in a different marketing, and they want that I should be going to recognize not in a city but in the world. So, what is your message to them? Because they are keep on doing something which they may not be doing it, and just to take a fame name they are going to portray it because sir I look after you as a pioneer and as a leader, and you have your benchmark, you done it by your way. There is no godfather, there is no one that stood behind you to make the stature what you achieved. So what is the message to them, sir?
I think marketing is required. There is no there is no doubt the marketing is not required, but simultaneously you have to give the results also.
Yeah, true.
Unless you give results consistently, and unless you are good to the unless you are not good to the patient, you have to be it is a multidimensional. You have to be kind to the patient, you have to be human, you have to be humble, you have to be knowledgeable also, and you have to do the marketing also. So all these
Yeah.
things, they have to be parallel. Only marketing will not work. With marketing, the patient, with the marketing, the social media, the patient will come for once to you. But unless you give result, that patient will not remain with you. And if the patient doesn't get the results, The negative marketing is a boomerang.
Mm, mm.
He'll tell
True, true.
again, he'll put on his Facebook that doctor, that hospital is not good. So it will go to the thousands of the people of his friends. So marketing with the genuine practice is also required.
Sir, now like we are talking about the leadership as well as the vision. You know, sir, we started under your guidance. We had done so many of Eagle projects and make them a good young endoscopic surgeon. We recognize them. You make them that every managing committee member, those who are going to get selected, make an attempt that they should go and present in the workshop or they will do a live workshop. So, what is your vision for those about the virtual platform they give? Usually, nowadays they are come up with the two things of a setting. They gives a virtual endoscopic that where you are just doing a knotting and the dissection on the virtual model, and some of them like you and me are trained in the endoscopy by assisting by going into the step by step manner because there are 3D versions which is coming up. The medical colleges they have, so, what is your as a vision for this particular training schedule?
Definitely, this advances in the teaching is it is helpful for the beginners. These simulators, because nowadays with so much medical colleges, the workload is not that much. So the government, the administration, they are buying the simulators, they are building the skill labs so they can practice on these virtual reality models, so that it is easier, there is no harm to the patient. Definitely, it is good for the beginners to learn the basic steps and then gradually you can shift to the patient. So definitely, this technology is helping us. It can be made available to your own hospital. You can
Mm.
practice suturing. Definitely, it is helpful for the initial practice, and then gradually you can practice on your real patients.
Now, sir, I will go again into switching over to your personal life. Sir,
Hmm.
what was the first time, like you are doing now thousands and lakhs of surgeries? What is the first time then where you seen there is a something bubbles coming in your stomach while doing some procedure? Every surgeon has, sir. I will be
Yeah,
honest to
yeah, yeah,
you.
yeah.
I also had the situations.
Yeah, in I think before 2005, when I initially came in Sambhajinagar for practice, I went to one Gynaec's hospital to do the endometriosis surgery, and that ovarian cyst was too much adherent to the rectum, and I dissected, and that gynecologist told me you have opened the rectum. There was the reverse peristalsis started in my stomach.
And sir, who will be your this thing like can you just tell me a one incidence
Hmm.
where you will say no, this is the case, I will walk through like easy but tend to be a difficult one in a workshop where you are like a ghost surgeon, there is a hardly any investigations come across you, sir,
Hmm.
but you as a lion go venture into it and you finished it in a no seconds that because they given you a very difficult case because you are a esteemed faculty, but that difficult case becomes so much easy for you, and then what is the feeling?
I think nowadays any endoscopic surgery, once we have the good team, that can be done in any setting. Only thing, the camera and the energy source has to be good there. But nowadays, that practice should not be done.
True.
We have to see the patient properly, because nowadays these those days are gone now. We have to properly see the file of the patient. We have to examine the patient, and we have to plan, and we have to counsel. Nowadays,
True.
people will not accept the bad outcome. We have to explain all the consequences of the what procedure we are doing, what is there. If this is there, we'll do this. If there is a superficial involvement of the rectum, we'll do the shaving. If there is a lesion is going up to the lumen, we'll do the discal resection. And if it is multifocal, we'll do the resection anastomosis. So
True.
all this counseling is required and consent is required.
Sir,
Blindly, you
again,
can't do anything.
sir,
And
again coming.
now there is no era of surprise. We have to
Yeah.
do the proper investigation and plan everything before we enter into the OT.
Yes, sir.
Yeah.
I wish to ask you, like nowadays, the live operative workshop, they have changed the the rules and regulation by the MCIs. I will
Yes.
not go into the rules and regulation because being it's a live podcast, will should not be raising any NMC guidelines.
Yeah.
But sir, do you think that these guidelines will be a beneficial, or this will restrict for the people to do a much more showcasing the different cases?
Definitely, these guidelines they have brought some restrictions, but I think they are good. They are good from the safety point of patient. Nowadays, they have made compulsory the ICU backup is required when you are doing the live surgery. Actually, I think it is good for the patient safety and surgeon safety also. Initially, we used to go to the remote places for the workshop, and there was hardly few resources available. The machinery is not working, that is not their patient, But with these guidelines, they have made responsible. The organizing chairperson is responsible for everything. So they are on alert mode. They will do the complete investigation, the consenting part. They will make every instrument available. They will make the facilities of the ICU available. I think it is good for us also and the patient also.
Yeah. So now I will, because it's a being a 45 minutes, you are talking to me, and I'm really happy that this was not been planned. This was not been questions are given or something like this is a true from my heart, whatever I am asking
Yeah,
you.
yeah.
So, sir, in your opinion, what defines a truly innovative surgeon?
A truly innovative surgeon is who does the thing in whatever resources that are available, giving the best outcome in that setting.
Wow. So now the like last rapid questions for only five questions I'll ask. The most important person in your life,
Wife,
most happiest place to live in.
Himalaya,
Sir, the belief of a innovation starts from.
need. Necessity is
Absolutely.
motherland of innovation.
Sir, and the last question, that what is the message that you need to give it to the young surgeons struggling between the innovation of enthusiasm and clinical practicability?
Always do best for the patient. Patient is the most important person in your hospital. You need to deal that patient, satisfy his need, and first do no harm.
Wow. Sir, today's, I think this last 45 minutes, what I gather the knowledge is a knowledge comes with the simplicity and the humbleness and the divine power which the God has given to you, sir. I will be honest from my heart because it's not the just to say on the platform. I admire the person. When I admire it, I admire fully. So, sir, it's the last 45 minutes. You are given the message about how the life should be led, how the innovations should be done, and what is the practicability for the new enthusiastic surgeons. And you rightly said the need is a power of innovation. Sir, from the Foxy side, as a committee chairperson of this family welfare committee, and we are indebted to you for taking out the time and the precious advice what you have given to all the Foxians who is watching this live. Thank you very much, sir, from the Foxy to you for your time and for your efforts, sir. Thank you very much.
Thank you so much, Dr. Ashish. You are, very wonderful person. Take out, how to take out the things from, any person. So you made the show very live. Thank you so much, Dr. Sunita Tandulwadkar, Madam, the President of Foxy, our visionary leader, for giving this opportunity. I really enjoyed this show, and I appeal this. I think this should continue, and I'll definitely attend the next podcast.
Yeah. Thank you. Thank you, sir.
Yeah, yeah.
Thank you for, and thank you all those who joined in. And this podcast will be there in the Foxy website throughout the life of mine. So thank you, sir, for being a part of it. And always you are having a special position in my heart. Thank you very much
Thank you.
for
Thank you
joining in.
much.
Thank you, sir.
Thank you. Thank you. I
Thank
really
you.
enjoyed it.
Thank you.
Thank you.